As we head into summer, we all tend to get a little more active, and while that's a good thing, sometimes it comes with other issues. Dr. Ronald Delanois is an orthopedic surgeon for GBMC and joins us now to talk about knee pain. Hi, doctor.
Hi, how are you?
I'm doing well. I've had a lot of knee pain off and on over my life, playing sports, walking, aging, all these things. This is a time of year when everyone is outside, including myself. So hiking, running, people play pickleball. What are some of the common knee complaints that you're seeing?
So, I think first of all, we have to comment about osteoarthritis. Osteoarthritis is endemic within this country. 35 million people suffer from osteoarthritis, and knee pain is probably the predominant one. Knee pain is very common because what do? We're bipeds, we walk, we want to be active, we want to get outside. And so the most common knee pains that we oftentimes see is the knee pain in the front of the knee, from going up and down stairs, from pivoting, twisting, all those types of activities. Yeah,
and then sometimes people aren't sure if their pain is caused by arthritis or not. So can you explain what happens when the knee starts to quote unquote wear out, as I say?
It's a great question. People come in all the time and think that it's just a sprain. And arthritis is a difficult diagnosis, primarily because it's slow, it's progressive. It doesn't happen all of a sudden unless you've had an accident, right? So overuse, there are many things that contribute to arthritis. Remember, arthritis is Latin for arthro, which is joint, itis, which is inflammation. So joint inflammation occurs from a variety of things, oftentimes activity, overuse, abuse. So I think that how do you know if you have arthritis? Well, if you have joint inflammation, that's a form of arthritis. What most people think about when they think of arthritis is, oh, I'm losing cartilage and I might need a surgical procedure.
Right.
And that's really the transition point.
And so at what point should someone stop trying to treat it themselves and then go see a specialist?
That's a fantastic question. I think the reality is that you don't need to run to the doctor, because oftentimes the doctor is going to recommend the simple things that mom used to give. Take some time, relax, take some anti-inflammatories like Tylenol, take some Motrin. Don't overdo it because they have side effects. But do those things for a little bit. Back off on the activity, change your shoe wear, because oftentimes our patients don't, they want to be more active, but they don't want to buy the right shoes. And so the consequence is they're really, really hard on their feet and they're really, really hard on their knees. Do those things first. If you're not getting better, that's the time to go see a physician.
And what are some of the most effective non-surgical ways that people can alleviate this pain?
So as I mentioned earlier, I think that the simplest things are sometimes the hardest things, right? I tell people all the time, your best friend, your worst enemy is the same thing. That's time. Give yourself some time and the body will take care of itself, right? That's first and foremost. The second thing we talk about at GBMC is nutrition. Nutrition is important because a healthy body creates healthy joints. So we think that's very, very important. Weight modification, weight control. We know that each additional abnormal pound of weight that you have, that doesn't mean you need to be skinny mini. I am not by any stretch of the imagination, but I think that being overweight, and we all have that difference, what that means, but being overweight, every pound equates to about 3 to 5 pounds of additional load across the knee. So if you can lose weight, that will also have a significant impact on your knees.
And has anything changed over the years? And when surgery is necessary, what should patients know?
So I mean, medicine in general is changing dramatically. Treatments for arthritis are changing. Currently, the treatments are still fairly similar, right? We do physical therapy, we do injections, various types of injections, cortisone. There's some debate about the value of cortisone. There's gel injections. There's also some debate about the value of the gel injections. And there's a study out in Stanford right now looking at potentially, and it's very preliminary, but there may be a point in time where we can inject something that will inhibit the proteins that cause arthritis, so the knee will last longer. But that's farther down the road, probably long past I'm gone in terms of retirement, and maybe when the good Lord calls me. But the reality is, I think it is in our future, so the things are ever evolving.
And surgery, I know a couple of people who have gotten the surgery, they didn't want to going into it, and then they got it, and they said it was life-changing, that they felt just so much better.
Right.
Yeah.
I think the right surgery by the right person, by the right patient, is always has the greatest chance of success. So what you want to do is when you find that physician, and I think at GBMC we have a fantastic team of people who are very caring and who are really interested in, first and foremost, taking care of the patient in total. So we will always approach it from a non-surgical approach. But when surgery is necessary, our goal is to educate the patient so they're well informed, and then give them an experience in which they have a fantastic experience at our hospital, which ultimately leads to a fantastic patient experience and leads to great success.
So where can people go to learn more?
So, we have, obviously go to the GBMC website, come and see us in our clinics, come and talk to us. We have a fantastic team throughout the GBMC organization to help educate our patients. And when you have an injury, we also have 2 walk-in clinics, one at Padonia, one at GBMC proper, and at the West Pavilion location, so that the patients can just come in if they have a concern or question and they're not sure. We're there to help answer those questions for them.
That's great, so that they can start there and then see where they need to where else they need to go within the GBMC system. I want to thank you so much for being on the show. We really appreciate it, and we'll be right back with more Midday Maryland right after this. Stay tuned.